Tecfidera is by far the most commonly prescribed multiple sclerosis disease modifying therapy. But what are the potential side effects? Let's have some fun. I'm Brandon Beaver, and I make videos about multiple sclerosis every Wednesday, so please subscribe and ring the bell for notifications. Now, I remember when Tecfidera came onto the market and was FDA approved in 2013. There was a tremendous amount of excitement around this drug. And when I was at a professional conference, the American Academy of Neurology, one experienced neurologist thought this drug could be so good and so safe that maybe our patients wouldn't even need to see us very often. They would just get the drug refilled from their primary care doctors, and they wouldn't be having side effects, and they wouldn't be having relapses. And there would almost be less of a need for us. Now, it turns out that Tecfidera isn't really a high efficacy medication. It's not as efficacious as the infusion medications, and it does have some potential side effects. But at the time, there was a lot of enthusiasm and a lot of marketing behind this drug. Now, Tecfidera is very similar to drugs used for psoriasis, including Fumaderm and Soranovo, mostly used in Europe. And these drugs didn't really have a ton of side effects, although people with psoriasis tended to use them very briefly and stop once the rash went away, whereas with multiple sclerosis, it's used chronically, so the risk is potentially greater. And people were very surprised that this drug would do anything for multiple sclerosis, but it is in fact effective in multiple sclerosis based on multiple clinical trials. Now, typically Tecfidera is dosed at 240 milligrams twice a day. And usually you start with a 120 milligram dose twice a day for 7 days, just because it can cause some symptoms early on, flushing and gastrointestinal side effects. And this tends to dampen down the side effects somewhat and make it more tolerable. Now, believe it or not, I actually did take this medication myself and did experience flushing. And I'll put up a card to the video where I discuss my experience with multiple sclerosis disease modifying therapies, including Tecfidera. Now, the way the drug works is it's dimethyl fumarate, and it's metabolized in the body immediately to monomethyl fumarate. And it's not exactly known how it works, but it has a couple of known effects that are potential mechanisms of action. One is that it reduces lymphocytes, which is a subclass of white blood cells, so it weakly suppresses the immune system. Another is that it activates a certain transcription factor, NRF2, which is known to be related to oxidative stress. So it's thought that it may work within the central nervous system itself, making the central nervous system more resistant to injury, but it's not exactly 100% known. Now, believe it or not, fumarate is actually just an intermediate of the Krebs cycle, which is a major metabolic pathway going on in every cell in your body at all times. So fumarate exists naturally within the body. So people were just blown away that this could have any benefit whatsoever in people with MS, but it does. So here are the data from the CONFIRM trial, which is one of the 2 phase 3 trials leading to this drug getting approved. And if you look compared to placebo and compared to glatiramer acetate, which is Copaxone, you can see that Tecfidera causes certain side effects. One is flushing, which is redness and itching of the skin, which I experienced. And it causes some gastrointestinal side effects, such as diarrhea, nausea, and stomach pain. Usually these are worse in certain people and people who just start the drug recently. And again, people try to take it with large meals and start at the 120 milligram dose. So this is an example of flushing, although I'll admit to you that this is just an Asian guy who has aldehyde dehydrogenase deficiency who consumed alcohol. Now, if you look at this diagram, you can see that a lot of the gastrointestinal side effects are early on. So when people have side effects, they often try to wait it out for a month or two and see if they go away, although people can have this side effect at any point. And what's happening here is, one, people kind of get used to the side effects and used to the drug, and the body becomes accustomed to it. But also a lot of people who have really bad side effects, they just stop taking it. The same is true with flushing and gastrointestinal side effects. Now, I talked about low white blood cell counts, and if you look compared to placebo and compared to glatiramer, you can see that people who take Tecfidera, and this is 2 different doses of Tecfidera at blue and purple, can have low lymphocytes. Usually the decrease is very mild, maybe 10-15%. However, in some people, they can have dramatic reductions in lymphocyte counts, and this can make people more susceptible to getting infections. So monitoring of the lymphocyte counts is recommended. Now, according to the product label, it's recommended that you stop the medication if the lymphocyte count is less than 0.5 for more than 6 months. However, this is quite aggressive. A lot of doctors would recommend stopping it, or at least stopping it temporarily, if the absolute lymphocyte count is less than 0.8, even on a single blood draw. Of course, you would have to discuss this with your clinician, depends on the clinical context. Now, why is the lymphocyte count such a big deal? Well, the problem is there are very rare cases of an infection known as PML, progressive multifocal leukoencephalopathy. You've probably heard about this because of its association with the drug Tysabri or natalizumab. And primarily, the risk of PML in multiple sclerosis drugs is with Tysabri, where the risk can be as high as 1 in 250, as you can see in this chart. However, PML has been rarely reported to occur with other multiple sclerosis medications. And just to give you a brief background, PML is caused by the JC virus, which is ubiquitous, it's everywhere, anyone could be infected with it. But usually the immune system just shuts it down, so it doesn't really cause any symptoms. But in rare cases of people with a weakened immune system, the virus can become activated and infect the brain, and the disease is progressive. It often involves multiple parts of the brain, hence multifocal, and it involves the white matter, hence leukoencephalopathy. And it's a horrible and potentially fatal disease, though luckily extremely rare. Now, the point is with Tecfidera, the risk is about 1 in 55,000, and probably greater if the absolute lymphocyte count is low, and most of the reported cases are with low absolute lymphocyte counts, so presumably this can be prevented in most cases if we monitor the cell counts. And the risk is lower than with a lot of these other medications, as you can see in the chart. If you want some information about Tysabri side effects, I'll go ahead and put up a card here. And if you want some information about the case of PML in a patient taking Ocrevus not exposed to other immunosuppressants, I'll go ahead and put up a card here. Now, what about other side effects? Rarely people can have serious allergies or even anaphylaxis, although this is uncommon, and liver injury has also been reported, although it's rare and usually resolves when the drug is stopped. Now, I haven't really seen this reported in people with multiple sclerosis, but with the other drugs in psoriasis, fumaric esters were reported to cause Fanconi syndrome, which is a rare kidney disease where the proximal renal tubules become dysfunctional and your kidneys start leaking certain electrolytes and amino acids, and it causes other problems. Again, we haven't really seen this, to my knowledge, in multiple sclerosis, but it's a potential side effect. Now, in terms of pregnancy and breastfeeding, Tecfidera is contraindicated. In animal studies, it's linked to low birth weight, reduced ossification or bony formation in the hind limbs of rats. And we haven't seen too many things in human accidental pregnancy registries, but there are some reported birth defects, such as pyloric stenosis, which is a gastrointestinal abnormality, and some cardiac abnormalities, including transposition of the great vessels and patent ductus arteriosus. So this drug is not recommended in pregnancy. However, it has a very short half-life, only about 1 hour, so many doctors would say that you could start attempting to get pregnant almost immediately after stopping the drug. It's also known that Tecfidera enters breast milk, so you're not supposed to take it during breastfeeding. So that's all I have. If you have any questions, please post in the comments below. Obviously, I can't answer very specific clinical issues, but if you ask in a general forum, I'll try to answer it to the best of my ability. And again, please subscribe for videos every Wednesday. And if you have any video requests, please post in the comments below.